and advanced disease formations. Azithromycin is there, which is purine synthesis inhibitor, so it will be used in pemphigus vulgaris, bullous pemphigoid, atopic dermatitis, chronic actinic dermatitis. Cyclosporin is a calcineurin inhibitor, and so it was used in psoriasis, and similar examples are there. Important category is retinoids. Basically, retinoids are a class of medication that are derived from vitamin A and are commonly used to treat various skin conditions such as acne, psoriasis, and skin cancers. There are two types and two categories like topical retinoids. So they are applied directly to the skin, and these are used to treat acne, psoriasis, and other skin conditions. Systemic, they are taken orally and are used to treat severe conditions, severe acne situations, psoriasis, and other skin conditions. As far as their mechanism of action is concerned, so it will bind to retinoic acid receptors. It will bind to these retinoid X receptors, which activates a cascade of events and which ultimately lead to changes in gene expression. There's inhibition of cell proliferation, so that will lead to reduce the severity of skin conditions like acne and psoriasis. There is differentiation of skin cells, and that will help in improving the appearance of the skin. So basically, they are indicated in acne, psoriasis, skin cancers, aging skin, and usually they have certain side effects like skin irritation, sensitivity to sunlight, birth defects. So systemic retinoids can cause birth defects, particularly if taken during pregnancy, and bone and joint pain. So systemic retinoids can cause bone and joint pain. There are certain precautions also which needs to be taken if pregnancy and breastfeeding. So systemic retinoids should be avoided. Sun protection is one of the things. So patients who are taking retinoids should use sun protection measures, including sunscreen and protective clothing. And there should be monitoring. That is one of the primary steps. So that should be taken into consideration. So as I mentioned, it is just to recapitulate the indications: acne, psoriasis, skin cancer, aging skin, hyperpigmentation, and side effects include skin irritation, dryness, flakiness, sensitivity to sunlight, headaches, and birth defects. So in this particular slide, we will review the mechanism and side effects. So usually in the mechanism, we have a binding action which will be binding to the retinoic acid receptors. So topical retinoids bind to retinoic acid receptors and retinoid X receptors in the skin, which activates a cascade of events. So the next step in this is inhibition of cell proliferation. So topical retinoids will inhibit the proliferation of skin cells, which will help to reduce the severity of skin conditions such as acne and psoriasis. There is differentiation of skin cells. Topical retinoids will promote the differentiation. So as far as after differentiation part is, we will be promoting the differentiation of skin cells, so it will help in improving the appearance. There is also collagen synthesis, so it will stimulate the collagen, which will help in improving the skin elasticity and reduce fine lines and wrinkles. Usually there are certain side effects. Skin irritation is one, where skin irritation will include redness, itching, and dryness. There's sensitivity to sunlight, which will lead to sunburn. There is dryness and flakiness, which will particularly be present in sensitive skin. There is post-inflammatory hyperpigmentation in darker skin tones. And common topical retinoids are retinol, which is a derivative of vitamin A that is commonly used over the counter, and retinoin is a prescription strength topical retinoid that is commonly used in treating acne, psoriasis, and skin aging. Adapalene is another example which is used for acne and skin aging. And other than this, there's azalene, which is a prescription strength topical retinoid. And there's certain precautions like sun protection, moisturization, gradual induction, as just to minimize side effects. And as far as pregnancy and breastfeeding is concerned, it should be used with caution during pregnancy and breastfeeding. So as far as the entire flowchart condition, we are trying to understand the mechanism, how is it inhibiting release how is it inhibiting and inducing pro-inflammatory pathways, also how the gene products will inhibit hypoproliferation of keratinocytes in pilosebaceous follicles, and also how the production of melanin and melanocytes will happen. So this is a very good flowchart for observation. So as far as contraindications are concerned and topical retinoids are concerned, so contraindications include pregnancy and breastfeeding, and there is hypersensitivity to vitamin A or retinoids. There is liver disease, there is kidney disease. There are topical retinoids which are utilized for acne, aging skin, and hyperpigmentation. Usual examples, as I mentioned, are retinol, adapalene, tretinoin. And systemic retinoids examples in severe acne, in psoriasis, and skin cancers. So usually acne retinoids will help in preventing clogged pores and reduce inflammation. In psoriasis, it will help in slowing down skin cell growth and reducing scaling. Skin cancers will help in preventing skin cancer by promoting cell differentiation and reducing cell growth. Coming on, the next interesting topic is antibiotics. So they are usually medications which are used to treat bacterial infections. In dermatology, they are commonly used to treat various skin conditions, including we have to categorize under the category of the types. So topical, they will be applied directly to the skin to treat bacterial infections such as impetigo, folliculitis, and systemic antibiotics, they are taken orally in conditions like cellulitis and abscesses usually. And as far as the common antibiotics are concerned, they include gentamicin, cephalexin, erythromycin, ciprofloxacin, and metronidazole. And we can also kind of divide the antibiotics in certain categories, like topical includes neomycin, erythromycin, clindamycin. Systemic includes penicillin, cephalosporins, and macrolides. Indications usually for the bacterial skin infections, like as I mentioned, for impetigo, folliculitis, and cellulitis. In acne, antibiotics like doxycycline and minocycline are indicated, so they will help in treating various conditions of acne. And rosacea is for we will use metronidazole and doxycycline. And we also have to consider the side effects like allergic reactions, GI based side effects, photosensitivity, and resistant bacteria. So again, coming on the indications, just to recapitulate, the bacterial skin infections, example impetigo and folliculitis, acne, rosacea, bacterial infections in wounds or surgical sites, and common side effects include gastrointestinal upset, nausea, vomiting, or diarrhea, and allergic reactions including rash, itching, anaphylaxis, there's difficulty in breathing, hives, and there may be yeast infections, there may be antibiotic resistance, there may be photosensitivity. Some antibiotics such as tetracycline and fluoroquinolones can cause photosensitivity, and resistant bacteria, the overuse and misuse of antibiotics can lead to development of resistant bacteria. Yes, coming on the contraindications, so there's hypersensitivity to the antibiotic, there's pregnancy and breastfeeding, there's kidney or liver disease, and the mechanism of action usually, as I mentioned, there is inhibition of bacterial cell wall synthesis, there is inhibition of protein synthesis, there's interference with the DNA replication. So usually these are the three important points which we should always remember in the mechanism of action. Classes, there are beta lactam antibiotic class, which includes penicillin, which helps in inhibiting bacterial cell wall synthesis. There is aminoglycosides, which is streptomycin, neomycin, kanamycin, which will interfere with the protein synthesis by binding to the 30S ribosomal subunit. There are tetracyclines, so tetracycline will inhibit the protein synthesis by binding to the 30S ribosomal subunit again. Macrolides includes erythromycin, clarithromycin, azithromycin, which will inhibit the protein synthesis. And there's miscellaneous, which includes chloramphenicol, which will inhibit bacterial protein synthesis by binding to 50S subunits and the bacterial ribosome. And there's clindamycin, a lycosamide antibiotic that will inhibit the protein synthesis by binding to the 50S subunit of the bacterial ribosome. So examples, they are used for mild bacterial skin infections, acne, rosacea. Examples are neomycin, erythromycin, and clindamycin. Systemic antibiotics, they are used for severe bacterial skin infections. There's widespread infection. There's infections that require rapid treatment. Examples are cefalexin, amoxicillin, and doxycycline. Use in specific conditions. So acne, the topical antibiotics will help in reducing inflammation and prevent scarring. In impetigo, it will help to treat mild cases, while systemic antibiotics treat more severe cases. Cellulitis will help in treating this bacterial skin infection. So antifungals, they are medications